In previous videos, we talked about the anatomy of a Fontan circulation, how the major veins in your body are connected directly to the lung arteries without there being any intervening active pumping chamber. In this video, I want to focus on some of the difficulty that you may encounter in Fontan circulations. The Fontan is an amazing innovation, but it's not perfect, and the longer that you live, the more likely you are to encounter some kind of difficulty. I want to give you an overview of the most common things we as ACHD doctors look for. I'd like to start off with the ventricle and then work my way backwards through the circulation. The ventricle is the lower chamber of the heart. It's the pumping chamber. Its job is to pump blood outside the heart to the rest of the body by contracting. As it contracts and relaxes, it pumps blood to the rest of the body. Now, over time, that pumping capacity can actually deteriorate, and that can happen to a variety of factors. But what happens is instead of contracting vigorously like this, it contracts with less force, kind of like this. What that leads to is less blood coming outside the heart, and then the blood behind the ventricle can pool, and the pressure will rise in the top chamber that's called the atrium. It'll rise in the lung arteries, in the Fontan conduit, all the way down to the veins inside your legs. These things can lead to what's called heart failure. The higher pressure in the lungs leads to the lungs becoming more fluid filled, and it can lead to shortness of breath. And then the elevated pressure inside your veins may lead to swelling, and typically that happens in your belly as well as your legs. These are some of the main features of heart failure: shortness of breath, swelling, an increase in weight because you're accumulating fluid, as well as a decline in your functional capacity. You're just not able to do as much as you were able to do before. And this happens because of poor squeeze, but can also happen in the presence of normal squeeze but poor relaxation. When the heart contracts, it also has to spring back to its resting state. And ideally, it does this very efficiently, kind of like a coil. Now, if the heart becomes more diseased and scarred up, it can become rusty. And so instead of springing back, it relaxes very slowly. This can lead to very similar symptoms as that of poor squeeze and can also lead to heart failure. We look for these kinds of things with imaging, either with an ultrasound and sometimes an MRI. That's number one. Number two is leaky valve. There's this valve that sits between the top chamber of the heart and the bottom chamber. Its job is to stay shut whenever the heart is contracting so that blood can flow forward and it doesn't leak backwards. However, sometimes it can start to get leaky. This happens because the heart gets so dilated that it stretches the valve out, or sometimes because of the morphology of the valve, the shape of it. If it becomes too leaky, this can also lead to heart failure symptoms. We look for this using, again, imaging, an ultrasound, or an MRI. Number three is arrhythmia. A normal resting heart rate is somewhere between 60 beats a minute and 100 beats a minute, and it should go up whenever you're exerting yourself, like an exercise, and it should go down at times of rest or sleep. What sets the pace is your sinus node. This is the captain. They send electrical impulses to the rest of the heart, telling the heart exactly when and how often to beat. Now, if the top chamber is diseased, because it's getting stretched out because of heart failure or because there's a lot of scar tissue from all the surgeries, you can have these other diseased tissues that don't listen to the chief. They're marching to the tune of their own drum. And so they form these circuits. They're kind of like loops. And so electricity goes round and round and round. So instead of your heart rate going bum, 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 it goes fast, like bum, 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 bum. This can also degenerate into more irregular rhythms like atrial fibrillation, bum, 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 bum. This may lead to palpitations, like symptoms of feeling your heart racing. It can also lead to heart failure symptoms, as well as, in worst case scenarios, it could lead to passing out. We screen for these and we look at these using things like electrocardiograms and Holters, which are just ways to monitor your heart rhythm at home. Now, number 4 is cyanosis. Cyanosis is essentially a low oxygen saturation, and normal oxygen saturation is 92% and above. One of the main reasons we do a Fontan surgery is to separate out the blue blood from the red blood. But a lot of people with Fontans may have oxygen saturations that are in the 80s or even lower, and that's just where they live. Why is that? One reason may be if you have a fenestration. A fenestration is an opening between the Fontan conduit and the heart that the surgeon placed at the time of the Fontan surgery. Now, they do this because it's important to always fill the heart, so that if there's ever a blockage somewhere here, the blood has an alternative path to get to the heart. Now, however, this blood never went through the lungs, so it never picked up oxygen, so it stays blue, and it can cause cyanosis. Another reason is veno-venous collaterals. If the pressure inside the lungs and in the Fontan gets too high, the blood has a harder time getting through, and so looks for alternative paths to get back to the heart that aren't as pressure or that are not don't have as much resistance. It forms long, windy blood vessels that actually bypass the lungs, and so similarly, they don't pick up oxygen and they stay blue. The analogy I like to give to that is that of traffic. Say you're a car here and you're looking ahead at the main highway and it's just filled with LA traffic. You can look at this exit and you'll say, hey, why don't I take the side street to get to my destination quicker? That's exactly what these blood vessels are doing. They're taking side streets to get to their ultimate destination faster, but in the process, they're actually not going through the lung tissue, so they're staying in blue, and that leads to cyanosis. Number 5 is your liver and kidney. We've talked about how integral to the function of a Fontan circulation is high pressure in your venous system. This high pressure is important as it helps drive blood forward through the lungs without there being an active pumping chamber. Now, it does have some important physiological consequences. Sitting underneath this, connected to this venous system, is your liver and your kidney. So they also feel this high pressure. And over time, that can lead to dysfunction of the liver and the kidney. You may have heard a term called Fontan-associated liver disease. It's a little bit like cirrhosis, but it's not cirrhosis. It has a very wide spectrum. It's essentially liver dysfunction because of elevated pressure. And it can have a wide spectrum ranging from no symptoms at all to symptoms that are similar to those that cirrhosis gives. When the liver is dysfunctional, it also places you at higher risk of forming liver cancer or hepatocellular carcinoma. This is why ACHD doctors do some form of surveillance. We typically get yearly imaging, either an ultrasound or an MRI, as well as blood tests to look for cancer, because we want to make sure we catch it early while we can do more about it. It's similar to, when you go for a colonoscopy or a mammogram. Number 6 is your lymphatic system. What is your lymphatic system? Well, it's kind of like another circulation, a third circulation. People know about your veins, that's the blue blood vessels. They also know about your arteries, that's the red blood vessels. Well, think of your lymphatics as a third blood vessel system that's green. They exist in the middle spaces and the cracks between the organs. And they cover everything. They cover your intestines, your liver. And their job essentially is to drain those middle spaces and make sure things are functioning normally. Now, when the pressure gets really high, the lymphatics, you can have proteins that spill from your lymphatics into your gut, and you can actually lose protein in the stool. This has a number of consequences. One of the most important has to do with fluid. The proteins inside your blood vessels have an important function of keeping blood and fluid inside the blood vessels and preventing it from leaking out. If you think of rice grains, when you add them to a pot, they absorb all that water. Proteins also similarly absorb water and keep things inside the blood vessels. Now, when you're deficient in protein, water will leak outside the blood vessels into these middle spaces, and it causes puffiness, swelling in your legs and your belly. Additionally, The protein is an important building block of antibodies. These are the same antibodies that you need to fight infection. So, this is what's called protein losing enteropathy. Losing protein in your gut, which can lead to things like swelling and being more predisposed to infections. We screen for this with lab tests, things like looking at your albumin, we ask about symptoms, and then we also sometimes do a test in your stool looking for a protein called alpha 1 antitrypsin. Finally, number 7 is clot. We've talked about how there's no pumping chamber, so the blood that is flowing through the fontan is actually going a little bit more slowly. It's more stagnant. Whenever blood flows more stagnant, it's more likely to form clots. And these clots can travel and end up getting stuck in all sorts of places. If it gets stuck in the lung circulations, that can have important circulatory consequences. If it ends up in the heart, it can travel. It can actually go all the way to the brain, causing a stroke. This is why everyone with a Fontan, as long as they can tolerate it, should be on at least aspirin. That's to thin your blood and to prevent stroke. And if you have extra risk factors, your doctor may put you on a stronger blood thinner, like Coumadin or a DOAC, and that may include either Eliquis, Xarelto, or Pradaxa. I hope this gives you an overview of some of the most common problems that a Fontan circulation may face. You know, lots of people with Fontan circulation live very healthy, productive lives and are asymptomatic, no symptoms. Now, however, it's not a perfect circulation, and the longer that you live, the more likely you are to encounter some of these issues. So it's very important that you follow up with an adult congenital heart disease specialist who is trained at looking at all of these. The earlier we can diagnose them, the better, because that can mean that we can treat them with medications. Sometimes it may need procedures, a surgery, or may need extra surveillance.